You know, since I was in the 9th grade, I knew I wanted to become a dentist. In my first semester of dental school, it was clear to me that not only did I want to become the best dentist I could be, but I wanted to make a career out of making other dentists the best dentists they could be. Aesthetic Professionals was really created to fill a missing link between dental school and practice. We're trying to teach very comprehensive hands-on dentistry to dentists where they can come and learn new techniques, cosmetic, reconstructive implant techniques. Dentists can come and increase their comfort zone and expand the menu of what they have to treat on their patients. As a result, they have better practices. They're happier about what they do. They get more passionate about their practices. Aesthetic Professionals really is in the business of making people more passionate. The bottom line is, these dentists are more successful. The bottom line is, these dentists are treating their patients better. I created Aesthetic Professionals to make better dentists. Now we're going to start doing our incisal reduction. So when we go back to our clinical case here, for our central incisor, we've got a worn incisor and we want to modify the length slightly, but it's minimally worn and relatively intact. And so we're going to prepare this for our B design. Now notice the angle that I'm holding the burr. I'm holding it at a angle going kind of from the buccal to the lingual. It's angled kind of incisally. And so think of it as almost like a facial bevel, if you will. It's not just a flat reduction. It's more of an angular reduction over that incisal edge. And you want to extend your reduction to the lingual edge to the lingual extent of the incisal edge. And usually what you'll see with incisors that have been worn a little bit, you'll see like a little worn incisal bevel, and we're going to extend our B design until we get to the lingual extent of that incisal bevel. So this is called the B design. So for our case today, we're putting B design incisal edges on all 4 of our incisors. And notice also at this point I'm not using water. I think this is optional. I'm doing a very minimal amount of reduction. I want to get really good visibility so I can see what I'm doing. Now we're doing the incisal reduction on a canine, and as I mentioned previously, canines and posterior to the canines, I like to use a C design. I feel by wrapping the ceramic veneer over the incisal edge, we just reduce the potential for peel. Keep in mind that as we go further posteriorly, we're going to have more occlusal stresses on our teeth. The canine is kind of a guidance tooth. And anecdotally, what we found over the years is if we don't wrap the incisal, we've noticed a little higher incidence of peel over the years. Since we started using the C design and wrapping over this incisal edge, we've really minimized the number of cases that we see with veneer peel. Okay, now our lingual extension, we try to extend it as far as we can to get a nice wrap, but we prefer to keep it short of the occlusal contacts if possible. If it's possible to include the entire contact, we would prefer to do that. So in other words, we try to keep the contacts off the margins if at all possible. It's not always possible, but we attempt to do that. In this particular case, I believe that we kept our finish line short of the lingual occlusal contacts. Now, one of the mistakes that you'll make is not connecting the buccal and lingual surfaces. And you see interproximally here, make sure that you reduce tooth interproximally.
Aesthetic Professionals, California's premier dental education center. For more information or to enroll, please contact us at 818-654-7100, 818-654-7100, or visit us online at aestheticprofessionals.com.